And on a scale of 1 to 10, how would you rate your response to this crisis?
I'd rate it a 10. I think we've done a great job.
There's been no consistency between local governments, I feel like, and state government.
I think it's been handled okay, but not in a necessarily professional manner.
It has been almost a year since the CDC began recording deaths from COVID-19, marking the start of the pandemic in the United States. In that time, there has been over 350,000 deaths attributed to this coronavirus. While the nation as a whole has experienced loss and suffering from this outbreak, Illinois has experienced over 1 million positive cases and over 17,000 deaths. Even in the small community of 1,900 people that live in Moweaqua, the 270 positive cases illustrate the challenges faced by leaders locally, at the state level, and in Washington, D.C. The overriding concern is for a plan that addresses the virus that is clear and consistent.
So I don't think there's anyone who knows cut and dry what we should be doing, but I think they're doing what they think they should be doing.
I'm hoping that the new president will take things more seriously than the current president does, and I think he will.
A long time they've dealt with other pandemics before. We had the SARS several years ago, which you guys are not old enough to remember, but when I was in medical school, there was a real fear that SARS, the original version, was coming here, and so we got prepared for it in medical school.
2003 saw an outbreak of a respiratory syndrome that spread quickly starting in Asia. Much like COVID-19, SARS-CoV is a virus with similar physical structure and transmission characteristics. In fact, while COVID-19 is the name given to the disease in our present pandemic, the actual name of the virus is SARS-CoV-2 and is so named because of its genetic relationship to the SARS-CoV responsible for the 2003 outbreak. In part, the similarities caused some to underestimate the impact of the virus, as the 2003 SARS-CoV only caused 8,100 infections with 774 deaths. While only 8 people in the US showed laboratory proof of infection, however, it is coronavirus variants of the SARS-CoV and the 2012 MERS outbreak that laid the foundation for how to address and develop vaccines for the virus causing COVID-19.
And then it kind of just died and petered out. There was also the bird flu, if you remember anything about that, which you probably don't as well. There were large concerns that it was going to start spreading throughout the country, and there were groups that were studying that and being prepared for it, and as we talked about in medical school, and I know there were groups at the hospital that were, okay, this is what happens, this is what we do here. So they had a little bit more of a protocol, I think, in place, and thankfully it never did, but unfortunately it did not stop this time.
Organizations like the World Health Organization, or WHO, along with their national counterparts around the world, and a variety of global organizations have addressed the spread of many diseases and have developed a best practices playbook to draw from when addressing new challenges. As early as January 30th, 2020, the WHO had issued guidances to all countries placing focus on containment, data collection, disease detection, isolation, contact tracing, spread prevention, and treatment. However, as early as March 7, 2020, the WHO expressed concerns that some member governments were not taking sufficient action and called on leadership at all levels and in all walks of life to step forward to bring about this commitment across society. Initially, the United States focused on closing borders to prevent entry, but by mid-March had established a White House coronavirus task, prompting a 15-day quarantine period.
With several weeks of focused action, we can turn the corner and turn it quickly. A lot of progress has been made.
By early May, President Trump was announcing plans to wind down the task force.
And that form is safety and opening, and we'll have a different group probably set up for that.
It was the politically motivated timetables and misinformation that prompted the United Nations, the WHO, and others to develop communication initiatives specifically to combat mis- and disinformation, and calling world leaders to not politicize the pandemic, but communicate clearly and scientifically.
Facebook and Google and Twitter said that they were removing information about the coronavirus as fast as they could find it, and were working with the World Health Organization and other governments and organizations to ensure that people got accurate information. There's so much inaccurate information about the virus out there. The WHO has said that it is confronting what they're calling an infodemic.
While the world has called for clarity and unity, in July 2020, President Trump announced the U.S. withdrawal from the WHO, citing disagreements about China's role in the pandemic and claims of conspiracy.
We will be today terminating our relationship with the World Health Organization and redirecting those funds. The world needs answers from China on the virus.
From the village hall in a small Midwestern town Wuhan, the WHO, and even Washington, D.C. seems worlds away. But for local businesses affected by mitigation measures, to empty school gymnasiums, to the screens of remote learners, SARS, CoV-2, and the resulting COVID-19 have had tremendous impacts. From the local doctor's office and the testing tent set up at its back door, the concern most often centers around, what is the plan? When will vaccines be ready and available? And how effective are the treatments? While the WHO, CDC, NIH, and other health organizations have from the beginning sent a consistent message of what is necessary to slow, prevent the spread of this disease, sadly, lack of consistency and clarity from leaders and policymakers means that this infodemic and resulting confusion leave many people in this small community with frustration and confusion. What would we like the President and Congress to address in 2021? We want a COVID-19 plan that is clear and consistent.